Tom is a 36-year-old from Bristol who's recovering at home after bowel surgery in Bath. His surgeon, Dr. Davies, typically performs regular post-operative follow-ups for every patient over the recovery period. Tom's follow-up plan has him returning to see Dr. Davies 3 times over the next 2 months to check on his progress. As follow-ups are precautionary to ensure a normal recovery, face-to-face appointments may not be convenient for Tom or an efficient use of Dr. Davies' time. However, Tom has an NHS personal health pod, which allows Tom to record a recovery diary, remotely informing Dr. Davies on his progress post-surgery. At key intervals, Tom is requested to record his pain levels, energy levels, and any potential symptoms that may indicate a clinical complication. These responses are recorded in his NHS personal health pod, and with Tom's consent is accessible to Dr. Davies' clinical support team. They can review Tom's information, allowing them to remotely prescribe and manage his symptoms. Tom also has an Apple Watch that tracks standard activity metrics like steps, sleep, and heart rate. All of this data is stored automatically in Tom's NHS personal health pod. The appointment clerk consults Dr. Davies to determine whether Tom needs to come in, have a virtual appointment, or skip the check-in altogether, based on the data stored in his NHS personal health pod. Dr. Davies determines a virtual follow-up appointment is appropriate, and based on Tom's availability in his NHS personal health pod, she issues an invite that he accepts. Dr. Davies' other patients are following Tom's lead, allowing her to spend more time with the patients that need it, both in surgery and in reduced outpatient clinics. Her patients have a better health experience and don't always need to travel to and from a hospital for a 10-minute follow-up. At one of these follow-up appointments, Dr. Davies lets Tom know that there may be new available therapies or trials for the chronic condition that ultimately led to his need for bowel surgery. Dr. Davies points Tom to a free, pod-enabled digital service called UPP that safely connects patients suffering from chronic conditions with clinical trials and available therapies. Tom can provide UPP consented access to a subset of personal health data on his pod, from his clinical record to wearable activity and genomics. All of the data is de-identified and anonymized before it is received by UPP. UPP can verify that the data in his clinical record came from his doctors, because it is all signed with cryptographic digital credentials that are verified by RSA. As UPP evaluates possible therapies and trial candidates, it surfaces additional questions that Tom can answer interactively. UPP identifies an available treatment that's a match for Tom, as well as one upcoming clinical trial, and provides him with information he can review with his doctor.